Good afternoon, everybody. It's Dr. Sisson here. Today, I'm going to go over something very important. It's the number one position that leads to neck pain. So this is huge. Most of my clients, we see a lot of neck and back folks. That's a lot of what we see. And commonly, those people have no idea what caused their pain. It crept up on them. And typically, to me, and what I've kind of noticed is usually it's postures and positions that lead to those types of pains. So today we're going to talk about that position most commonly I see that leads to neck pain and how to take care of that. So with neck pain, the most common position that leads to it is this. I'm going to show you guys. Okay, watch closely. That right there. Now that's a little exaggerated. It might not be to that extent. It might be something like that. But that forward head posture, people don't think about it. They get in the habit of doing it. That can lead to a lot of stress to the neck, a lot of stress to the muscles, a lot of stress to the insides of the joints. And that can lead to problems with movement, stuff getting within the joint. And that leads to people, taking 4, 5, 6 ibuprofens a day, worrying about painful surgeries or injections, not being able to go on vacations, play with their kids. It just bleeds into everything in life. So now that you know that that's the position that causes and can make the pain worse, you got to ask yourself, what can you do about it? So one of the best things that you can do is rearrange the workplace and home. So figure out positions that you're at a lot throughout the day and change them. So at work, most common thing I see is the computer. It's too far away. And that leads to that forward head posture. So what you can do is you can scoot the computer closer to you, scoot your chair closer, get it right in front, and that alone will take care of a lot of the stress to the neck. When you get home, look at where the TV is at. If it's far away from you, if you can scoot the TV closer or just move the furniture a little bit closer, move your chair closer. Another big thing is TV position. It could be that it's too high up if it's one that's mounted, and you may actually want to lower that down, and that can help also get the neck in a more neutral position and reduce the stress. Same deal at home with your computer. Try to get it close to you by just arranging that in a certain way and just getting out of that position. You're effectively treating your neck when you're hanging out at the house and at work. Another thing you can do is to change positions. Every 30 minutes, get up, walk around. Doesn't have to be long, but by doing that, even if you got the worst posture in the world, it's going to reduce the stress and make you feel better. Another thing you can do is have good posture. If anybody tells you that you can do that by yourself without any help, they're lying. Because if you hold that good position with your chest up and your head straight, within a minute or two, you'll forget. Any PT is the same. They'll lose that position and get into the forward head posture. So what you can do is use something to push your chest up and get you in a good position. So if you're sitting in a chair, it's best to scoot back, get your bottom all the way to the back, and then get a small roll, towel roll or a small pillow behind your lower back that will push your back in a good position, lift your chest up. Something even better is something we have here. It's called a McKenzie roll, and it has the same type of purpose. It fits in the lower back, and it gives you good posture. And the best part about it is you don't have to think about it, and that will get your neck in a better position, get you out of that forward head position. And the last thing, and this is something no one thinks about, is glasses. If your vision's off and you need to get your prescription changed, or you need to get glasses in the first place, that's a great idea, because a lot of times if you're watching TV or looking at the computer, you're squinting and your head is getting in that position, and that can significantly produce neck pain, even headaches. So those are some simple things you can do, but I found in the clinic, simple is what works. If you want some more help, feel free to shoot us a call at 804-493-0002. We do a few free phone consultations every week. That's basically where I can hear your own individual case, see if we can help you, and determine treatment routes for your problem, and get you off all those pills and away from surgery. So that's it for today. Try some of those tips, and I think that will definitely help you. Y'all have a great one.